You're hunting. One wrong step, crack. You hear it before you feel it. You collapse. You look down. Your leg isn't straight anymore. It's bent where no leg should bend. Immediately, everyone around you stops. 3,000 years ago. This wasn't just painful. It could decide whether you ever walked again. There's no ambulance, no hospital, no x-ray, no painkillers. Just you, a broken leg, and the people standing around you. So what happens next? Do they leave you to die? Or did ancient people actually know how to fix a broken bone? The answer is far more surprising than you think. The first thing they do is stop you from standing. Not because they understand fractured bones, not because they've studied anatomy, because they've seen this before. Generation after generation, people noticed something. Every time someone tried walking on a broken leg, it became worse. So they learned the first rule of fracture treatment: don't move it. That simple observation would eventually become one of the foundations of modern orthopedics. Now someone disappears into the trees, not looking for medicine, looking for sticks, straight branches, palm bark, bundles of reeds, anything rigid enough to stop your leg from bending. The broken limb is wrapped tightly using strips of linen, leather, or woven plant fibers. No plaster cast, no fiberglass, just wood, rope, and hope. Yet here's the remarkable part. Archaeologists have found prehistoric skeletons whose broken bones healed perfectly. Some are more than 20,000 years old. That means these splints worked. Not every time, but often enough. Fast forward to ancient Egypt. Around 1600 BC, someone copied one of the oldest surgical textbooks ever written. Today we call it the Edwin Smith Papyrus. Unlike many ancient texts, this one contains almost no magic, no curses, no spells, just injuries. 48 real medical cases, broken bones, dislocations, head wounds. Each one follows the same pattern. Examine the patient, make a diagnosis, choose a treatment, or admit there isn't one. Some cases are labeled, an ailment I will treat, others, an ailment I will contend with. And then comes the sentence no patient wanted to hear. An ailment not to be treated. In other words, you're going to die. Imagine hearing your doctor say that. 3,000 years ago. Then archaeologists found something extraordinary. Not the papyrus, the patients. At an Egyptian cemetery called Naga, researchers uncovered skeletons with their splints still attached. Wood, palm bark, plant fibers. Exactly where ancient doctors had placed them thousands of years earlier. One belonged to a teenage girl with a shattered thigh bone. The splints were still wrapped around her leg. A blood-stained palm fiber pad still covered the wound. Her bone never healed. She probably died shortly after the injury, but only a short distance away. They uncovered another patient. This time, the broken forearm had healed. The splints had done exactly what they were supposed to do. That contrast tells us something powerful. Ancient medicine wasn't blind luck. Sometimes it failed, sometimes it succeeded. Exactly like medicine today. Now comes the part you definitely wouldn't enjoy. Before they could splint your leg, they had to straighten it. Imagine 4 people surrounding you. 2 hold your shoulders, 1 braces your hips, another grabs your ankle. Then they pull, slowly, carefully, not to torture you, to force the broken ends of bone back into alignment. No anesthesia, no morphine, maybe some beer, maybe wine, maybe nothing. Just a strip of leather between your teeth and every ounce of strength you have. Then something unexpected happens. They cover the wound with honey, not because they know about bacteria. Nobody will discover bacteria for another 4,000 years. They use honey because experience tells them wounds treated this way sometimes heal better. Modern science eventually confirmed something remarkable. Honey naturally slows the growth of many bacteria. Ancient doctors had stumbled onto a treatment that actually worked. Not because they understood why, because generations of observation had taught them what helped. 1,000 years later, Hippocrates described almost the same process. Pull the bone straight, keep it still, wait. Then Roman doctors taught the same idea. And today, Orthopedic surgeons still follow exactly that principle. Reduce the fracture, immobilize it, allow the body to heal. The materials have changed, the science has changed, the principle hasn't. So, what happened if you broke a bone 3,000 years ago? You didn't get an x-ray, you didn't get a plaster cast, you definitely didn't get painkillers. But if an experienced healer reached you, if your bone could be pulled back into place, if infection stayed away, there was a very good chance you'd walk again. The strange thing about history is that we often imagine ancient medicine as nothing but superstition. Sometimes it was, but sometimes it was careful observation passed from one generation to the next. The people who treated broken bones in ancient Egypt didn't know about cells, or calcium, or bacteria, but they understood one simple truth that's still at the heart of modern medicine. Straighten the bone, keep it still, let the body do the healing. 5,000 years later, doctors are still following the same rule. If you enjoy stories about ancient medicine, forgotten discoveries, and the incredible ways our ancestors solved impossible problems, subscribe to Primal Explained. Because history isn't just about the past, it's about discovering how much our ancestors understood, long before modern science caught up.